If an individual has employer group health insurance coverage, this video is really important to watch and pay attention to, because when it comes to employer group coverage and needing to enroll in Medicare when an individual is turning 65 is sometimes the most confusing and the most misunderstood. In order to attempt to help to make this simple and easy, again, our goal is to make this simple as 1, 2, 3. We're going to refer to group coverage as either working employer group insurance coverage or retired employer insurance group coverage. Both are treated differently. See, although the insurance may be provided by the same employer, Medicare views someone who is still working and being provided group health insurance benefits by their current employer differently than someone who's retired and they're no longer actually working for that particular company. So understanding what Medicare considers working is really, really important at this point. If an individual is retired at the age of 65, but their spouse is still working, and both are covered under their current employer group health insurance coverage, Medicare will still consider this working employer group health coverage because one individual was still working and they were covered under that group insurance plan. Even though the individual may be retired and eligible right now for Medicare at 65, their spouse or significant other or family member is still working and contributing to the Medicare taxes. If one of the individuals is still working and they're covered by that employer's group coverage, the federal government still views this coverage as working even if the person who's eligible for Medicare at 65 is retired. So hopefully that makes some sense to you, is that if somebody in the family is still working and you're on that group insurance coverage and you're retired, Medicare will still consider that working group coverage. So Medicare has different rules for working versus retired. So when it comes to enrolling into Medicare Part A and or B, those that are enrolling into working employer group insurance coverage versus those that are retired group insurance coverage, here is the general rule of thumb when it comes to enrolling into Medicare at the age of 65 that might help you. So if someone is still working, they may wait to sign up for their Medicare Part A and Part B. That's the general rule of thumb. If someone's retired, they must register. So if you're retired, you must register, you must enroll in Medicare Part A and Part B. For those that are still working, they may delay it and get an SCP down the road. If you want to learn a little bit more about special enrollment periods, there's a video specifically on special enrollment for those that wait to sign up for their Medicare after the age of 65. So we're going to first look at working employer group insurance coverage, because Medicare actually has some different rules that are based on the size of the company that you should be very well aware of. We're going to first look right now at working employer group insurance coverage, because Medicare has actually different rules based on the size of the company that you should know about. Sometimes Medicare doesn't make any sense, and this is where Medicare just does not make any sense, because Medicare has different rules based on if a company has less than 20 employees versus a company that has more than 20 employees. So let's first look at working employer group coverage with fewer than 20 employees. It's really important that the individual that's turning 65 who's still working and covered by their employer group coverage to find out if that company has more than 20 employees. Because if the individual works for a company that has less than 20 employees, that individual must take Medicare A and B. Let me repeat that. If the company has less than 20 employees, that individual must take Medicare Part A and B, or they will not be eligible for a special enrollment period SEP in the future. This is a Medicare rule that just does not really make any sense, but it has to do with how Medicare coordinates with the small group insurance versus the large group. So even if the individual or their spouse is still working and they're covered by the current employer's group coverage when turning 65, Medicare states that the individual must take their Medicare Part A and B if the company has less than 20 employees. So regardless if the individual or spouse can or would like to keep the current group coverage, the size of the company dictates that they must enroll in Medicare Part A and Part B. To have a better understanding of this rule, it's important to know that small group will coordinate with Medicare differently than how the large group will actually coordinate the benefits with Medicare. See, small group insurance is defined by Medicare as having fewer than 20 employees. Medicare Part A and Part B will become the primary insurance and the small group insurance coverage will be the secondary insurance. This makes it necessary for the individual to enroll in Medicare Part A and Part B at the age of 65, regardless if they keep the small group insurance coverage or select another option like a Medicare Advantage plan or a Medigap supplement. So again, to recap this is that if the company has less than 20 employees, Medicare would be the primary insurance and the group insurance would be the secondary insurance. So it's different with large group insurance, which is defined by Medicare as having more than 20 employees. They coordinate differently than that of small group. The large group insurance coverage will remain the primary insurance even if the individual remains working for the company, regardless if they were to enroll in Medicare Part A and or Part B. The group insurance always stays the primary insurance when someone is working for a company that has more than 20 employees. So when it comes down to small group insurance, here's what you should consider when looking at other coverage. An individual working for a company with fewer than 20 employees should consider a Medicare Advantage plan or a Medigap supplement since they must take Medicare Part A and B. This individual will already be responsible for the Part B monthly premium of $148.50, which is standard in 2021, regardless if they decide to keep the small group insurance coverage or they don't pass the age of 65. There's only two reasons why somebody that's working for a company with fewer than 20 employees should actually consider keeping that small group insurance plan, even though they must still enroll in Medicare Part A and Part B as their primary insurance. So here are the two questions that an individual should be asking themselves if they're still working and they can actually keep that employer group coverage regardless of the size of the company. The first question they should ask themselves is this: do they have any dependents on their group insurance coverage that would be affected if that insurance coverage was canceled? The second question: are they taking high-cost brand name medications that would be better covered under that group insurance versus under a Part D standalone plan or through a Medicare Advantage MAPD plan? If there are no dependents on the group coverage that would be affected and the individual is not taking high-cost brand name medication that would be better covered under the employer group health insurance plan, that individual should look at other coverage. They should consider enrolling into a Medicare Advantage plan or look at a Medigap plan, since they will be already required to enroll into Medicare Part A and Part B. So in conclusion, when it comes down to small group insurance, an individual turning 65 with small group insurance, less than 20 employees, must take their Medicare Part A and B and pay the standard monthly Part B premium of $148.50 in 2021 in order to avoid any penalties in the future. This individual will need to be enrolled into Medicare Part A and B during their 7-month initial enrollment period IEP. This individual should speak to an insurance agent to discuss whether a zero premium Medicare Advantage or investing around $100 into a Medigap supplement plan would be best to fit their needs. If you're in this situation, please give us a call here at Healthcare Solution Direct so we can look at your current situation and give you some advice on exactly what you should do when it comes to your health insurance. Let's now talk about working group employer coverage with more than 20 employees. See, if an individual or their spouse is turning 65 and they're working and their health insurance coverage is being provided by their current employer with more than 20 employees, they can delay their Medicare Part A and or B. The individual may delay their Medicare Part A and or B until they or their spouse stop working or they lose that coverage. The individual will not be penalized by Medicare for delaying their Medicare Part A and or B. See, Medicare will grant that individual or spouse an SCP, a special enrollment period, when they decide to stop working or within 8 months of losing that coverage. So let's do this right now. Let us explore why someone who's still working and covered under their current employer group coverage should still look at enrolling into Medicare Part A and Part B. See, we've talked about this in previous videos. The individual will need to get their HR benefits coordinator to fill out the CMS L564 request for employment information in the future when they decide to enroll into Medicare through a special enrollment period SEP. The process of requesting and getting all the paperwork necessary to submit to Social Security can be very, very stressful and very time consuming. So during the COVID-19 pandemic, there was a major delay to processing the paperwork needed for that special enrollment SEP, which caused a lot of headache and a lot of problems for a lot of individuals. Most of the time, from our experience, the individual will need their Medicare Part A and/or B coverage to start within 30 days with their SEP. If there's a delay in Social Security processing the information, it could be a very, very stressful time for that individual. So we'd encourage you to go ahead and sign up for your Medicare A and B during your initial enrollment period. See, an individual can enroll into Medicare for just the standard Medicare Part B premium of $148.50 a month in 2021. The other positive thing is the individual can enroll during their 7-month initial enrollment period IEP and not need to worry about having to rush to get a special enrollment period SEP in the future. We've seen so many clients of ours and so many beneficiaries that have had to stress about getting all this stuff in place during an SEP. An individual could also choose to enroll into a zero premium Medicare Advantage plan. That'd be very similar actually to their employer group health insurance coverage and may even be better with additional benefits that they're not currently actually receiving from their group insurance plan. Also, an individual could also choose to invest around $100 a month to purchase a Medigap supplement plan that might give them better coverage and flexibility that will actually cost less than their current employer group insurance coverage. There's a lot of things to consider when someone is still working and covered under their group insurance, but the individual should very highly consider signing up for their Medicare A and B during their initial enrollment period. There are two questions that we've discussed earlier when we talked about small group health insurance coverage that will still apply to someone that works for a large group and can keep that coverage. And individuals still should ask themselves these two questions that we asked earlier if they're still working. Do they have any dependents on their group coverage that would be affected if they went ahead and canceled the insurance and went on Medicare? The other question, are they taking any high-cost brand name medications that would be better covered under the group insurance plan they currently have versus that of a Part D standalone or an MAPD plan through a Medicare Advantage? If there are no dependents on the group coverage that would be affected and the individual is not taking high-cost brand name medication that would be better covered under the employer group health insurance plan, that individual should look at other coverage. Just like we talked about with employer coverage under 20 employees, that individual with a group insurance plan with more than 20 employees should still consider enrolling into a Medicare Advantage plan or looking at a Medigap supplement plan. On a side note, when we're talking about group insurance, health savings account do not work well with Medicare. See, if an individual has an employer group health insurance plan that has a high deductible plan with a health savings account HSA attached to it, it would be advisable not to enroll into even Medicare Part A if they would like to still make contributions. Here's why. Anyone with a health savings account HSA can no longer contribute pre-tax dollars or have an employer contribution if they enroll into any part of Medicare, which includes Part A. So if an individual wants to continue to contribute to their HSA account after the age of 65, they must stop collecting their Social Security retirement benefits at least 4 months leading up to the age of 65. Because remember, if somebody's collecting Social Security at least 4 months prior to turning 65, they will automatically be enrolled into Medicare Part A and B. They can decline Part B, but they cannot decline Part A. So as soon as the individual is automatically enrolled into Medicare because they were drawing their retirement benefits, they will not be able to decline the premium-free Part A. This will be a problem for someone who is still wanting to contribute to their health savings account HSA. An individual, remember, can no longer contribute to a health savings account HSA if they have any part of Medicare, which also includes the premium-free Part A. So if an individual does not enroll in either Medicare Part A and or Part B, they can continue to contribute pre-tax dollars to their HSA. See, once that individual decides they want to enroll into Medicare Part A and or Part B, they will need to stop contributing to that HSA account at least 6 months prior to their effective date. Here's the reason. The reason is that their Medicare Part A will be backdated 6 months prior to Part B effective date when they go to enroll into the future. So if for some reason someone did not stop contributing 6 months prior, they may incur an income tax penalty on the funds that they contributed to their HSA with pre-tax dollars after they have been enrolled in Medicare Part A. So an individual might find it actually in their best interest to stop contributing to their health savings account HSA when they turn 65, just to ensure that they do not make any mistakes in the future. But now you have a little bit better of an understanding of how HSA accounts work with Medicare. So when you're turning 65, if you have an HSA account and you would like to go ahead and still contribute to it after 65, you should not take any part of Medicare, which includes Medicare Part A. If you want to play it safe, at that point, stop contributing to your HSA account and go ahead and sign up for your Medicare Part A and Part B. So in conclusion, when it comes to large group insurance, an individual turning 65 with large group health insurance with more than 20 employees, they may delay their Medicare Part A and or B and not need to pay the standard monthly Part B premium of $148.50 in 2021. This individual will be able to enroll into Medicare Part A and or B during a special enrollment period SEP later in the future when they decide to stop working within 8 months of actually losing that coverage. This individual should still speak to an insurance agent to decide whether taking their Medicare Part A and or B and looking at a zero premium Medicare Advantage plan or investing around $100 into a Medigap supplement plan would best fit their needs. We'd encourage you, if you have any questions about that, please give us a call here at Healthcare Solutions Direct so that we can help point you in the right direction for exactly your particular situation.